Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about out-of-network billing. This is an important topic to discuss because there's a lot of confusion behind what out-of-network means, and then also some of the differences in the billing between in-network and out-of-network. Now, if you're a practice that is willing to bill insurances in which you are out of network, which means you have not signed a contract with them, which would bind you to accepting their fees of what they reimburse for services, then you are considered out of network. You might be credentialed with the insurance company. They may have vetted you, said, yes, you're great, you're good to go, we'd love to have you. But if you have not physically signed a contract agreeing to their fees, their other stipulations and all of that, then you're still out of network. A lot of times you can be credentialed and be waiting for that contract to come over. There are times where people have signed the contract, but the effective date isn't yet. And so you're seeing patients with that insurance, but it's before your effective date. So you're still considered out of network. That's why in my other videos, I say it's really important to pay attention to the effective date of when you become participating or in network with your insurance companies when you're working on all of that, because you're going to be out of network until that effective date. Now, out-of-network billing has become more complex than it used to be. And I say that because most insurances used to still have out-of-network benefits. That meant that if I had Blue Cross Blue Shield or Aetna and I decided to see a physician who is out of network with either of those insurances, I still had benefits. They weren't as good, and I had to pay more out of pocket as a patient than seeing a provider who is in network, but I still had benefits. That is not the case now. There are many insurances out there where they do not have any out-of-network benefits. That means it gets completely denied and the patient has to pay 100% out of pocket. Patients need to know this, but unfortunately, it's very hard for people in our realm and in our careers and in this industry to understand insurances, let alone to expect people who do not work in the healthcare field and patients to understand their benefits. Out-of-network benefits are becoming harder and harder to bill as well, because if you do bill out-of-network and they do have out-of-network benefits, a lot of insurances, instead of sending you the money that they will pay you for the service, they are sending the checks to the patients and asking the patients to bring those checks to you. Unfortunately, patients don't ask and think, why am I getting a check from my insurance company when I pay them every month? And they cash the check and they think it's money that is owed to them. It's not clear to them or communicated very well to them that that money actually needs to be signed over to the provider in which offered and provided those services that they're paying for. So not only is the patient responsible for handing over the insurance check to you, but then they're also going to have to write whatever check they need to make for their responsibility. Now, a lot of patients don't realize that out-of-network also means that they're going to be responsible for more out-of-pocket than they would as well. So they get a sticker shock, or they get shocked about how much they're going to have to pay because, again, they don't understand what out-of-network means. So if you have a patient that comes in or wants to be seen and all you tell them is, we're out of network with your plan, a lot of times they'll go, okay, no problem, because they don't understand. And I feel it is the doctor's office responsibility to make sure, in order for them not to upset patients or make them feel like you're trying to get one over on them, because these are the responses I've gotten from patients even when we thought we were very transparent about it, and explaining that out-of-network benefits usually requires the patient to pay more out of pocket because they cover less, and that you have more flexibility on how much you're charging, because basically you haven't agreed to a contracted rate with them by not having a contract. And if you bill $150 for a service, then you can bill that $150. There's no allowable adjustment from there. And then if they only cover 50%, because it's a, out-of-network benefit 50-50 coinsurance, let's say, then the patient is going to have to pay that other 50%. There's no adjustment. So they're being billed and paying for that $150. Where if they saw an in-network doctor for that $150 and they're only allowed to pay you $90 because that's the agreed upon contracted rate, then they only have to worry about the coinsurance towards that $90 and not the $150. And a lot of patients don't understand that. So I think it's best for you to have some type of document that you have them read and sign to understand. If you're going to bill out of network, you put in there about the checks and that they may be receiving a check from their insurance company, and that's actually money owed to you, so they need to be bringing that money to you. And also letting them know that if they don't have out-of-network benefits, which hopefully you're checking before you see the patient, or asking the patient to check and see if they have out-of-network benefits before you see the patient, that they're going to be responsible for that fully out of pocket. But out-of-network benefits aren't as cut and dry as they used to. A lot of doctors' offices are not aware of this, that there's less insurances that have out-of-network benefits and that they send the checks to the patient. It's just ridiculous. But they'll find every and any way a lot of times to make it hard for people to see patients, and that they would have to pay because they really want to incentivize people for seeing in-network providers for one. And the insurance world is not easy. So anything you can do to help educate your patients, educate your staff, educate yourself, and understand what is going to happen if you do provide these services and bill for out-of-network benefits or billing insurances that you're out of network, then you just need to be able to know how to communicate to your patients and let them know what to expect as well. I hope this makes sense. I know it's a lot of words, but if you have any questions or comments, leave that in the comments for me. Definitely smash that thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. And I hope you guys are doing well. Take care of yourselves, and we'll talk to you soon. Thank you. Bye-bye.